Angiotensin 2 receptor blockers, ARBs, they are the alternative if the patient develops dry cough. Losartan, irbesartan, they block angiotensin receptors, decreasing the activation of angiotensin 1 receptors by angiotensin 2. And the pharmacologic effects are similar. Renin inhibitors, L-ascarin. It is available for the treatment of hypertension. L-ascarin directly inhibits renin and thus acts earlier in the renin-angiotensin-aldosterone system. L-ascarin should not be combined with any ACE or ARBs in the treatment of hypertension. It can cause diarrhea, especially in higher doses. It will also cause cough, angioedema, but less often than ACE inhibitors. L-ascarin is contraindicated in pregnancy. L-ascarin is metabolized by CYP34A and subjects to many drug interactions. Then calcium channel blockers are recommended as first line treatment for black patients. They are also useful patients with diabetes, stable ischemic heart disease. High doses of short-acting calcium channel blockers should be avoided because of increased risk of myocardial infarction due to excessive vasodilation and marked reflex cardiac stimulation. Now, classification of calcium channel blockers. First, which dilate the coronary vessels, nifedipine, verapamil and diltiazem. Work on AV conduction, nifedipine, verapamil and diltiazem. Frequency of adverse effects, most is nifedipine, then verapamil and less diltiazem. Diphenylalkylamines, verapamil, and it affects both cardiac and vascular smooth muscle cells. It is used to treat angina, supraventricular tachyarrhythmias and prevent migraine and cluster headaches. Then benzodiazepines. Diltiazem is the only member of this class currently approved. Verapamil and diltiazem affect both cardiac and vascular smooth muscles and less pronounced negative inotropic effect on heart. Dihydropyridines, the class of calcium channel, include nifedipine, amlodipine, felodipine, isradipine, nicardipine, nisoldipine. These agents differ and all have much greater affinity for vascular calcium channel than for calcium channels in the heart. Particularly beneficial in treating hypertension, and they show little interaction with the CVS drugs such as digoxin or warfarin and are used as an adjunct. Action, they play an important role. The calcium channel antagonists will block the inward movement of calcium by binding to L-type calcium channels in the heart and in smooth muscles of coronary and peripheral arterial vasculature and will lead to relaxed dilating arterioles, but they will not dilate veins. Therapeutic uses, they are used as an initial or add-on therapy. Treatment of hypertensive patients who have asthma, diabetes, peripheral vascular disease, because unlike beta blockers, they do not have potential to adversely affect all these conditions, so they can use in these patients: asthma, peripheral vascular disease. Used in the treatment of angina, diltiazem and verapamil are used in the treatment of atrial fibrillation. Pharmacokinetics, short half-life, 3 to 8 hours. Sustained release preparations are available. Adverse effects, first degree atrioventricular block, constipation are the most common dose dependent and should be avoided with heart failure or AV block because of their negative inotropic effect, that is force of cardiac muscle contraction. Inotropic is force of cardiac muscle. And dromotropic, that is velocity of conduction effects. Dizziness, headache, fatigue, flushing, dizziness, headache, hypotension and peripheral edema. Then alpha adrenoceptor blocking agents.